Hey guys, it's Dr. May. How are you? If you might have noticed, I've done some videos in the recent past about what I call parts of self, right? So different self states that we have and how to deal with them and identify them and stuff like that. So I thought I'd do one more specifically on borderline personality disorder, especially because a lot of the folks that seem to like my videos have borderline personality disorder. So it's kind of like a way to get to know yourself a little bit better and maybe kind of deal with your parts in a more effective way, more specifically. Okay, so I got this from a book about schema therapy, and that also kind of deals with parts. Okay, so it's a bunch of therapies out there that deal with pieces and parts of ourselves. Okay, so we'll do a little of that today. So borderline personality disorder, parts of self. Okay, here we go. So just as an overall summary, I'm going to break this down in other slides, but just so you can see what's coming. So basically, we have an abandoned child self, which is like our most vulnerable part. And then there's like three other parts, the angry impulsive child, the punitive parent, and the detached protector that come in to help protect and defend the abandoned child from threats from other people or from the environment or from even herself or himself, okay? And they kind of work together in a kind of a borderline personality disorder cluster, okay? So our main goal though is to dig out our healthy adult self, which is in there, even if we don't always get in touch with it, to help to recruit the healthy adult, to help manage the other parts better, okay? So what I'm gonna do is I'm gonna talk about those four parts, how they display themselves, and how we can help manage them better and also help to heal them, okay? So that's gonna be the gist. So here we go. All right, so abandoned child. So picture the abandoned child as somebody who's really deeply wounded, right? Maybe you've had really painful experiences with caregivers, maybe felt abandoned or abused or deeply invalidated, and feels all the pain and terror of that feeling, of that experience rather. So there's a real deep sadness here, like very vulnerable emotions, sadness, shame, fright, terror, just feeling very, very vulnerable. And like a little child, this part is very defenseless. It's not able to protect herself or himself very well. So there's kind of a fragility there, an innocence there, like that little girl in the picture who seems very frightened and scared and very small, okay? The abandoned child is overwhelmed with raw emotions and kind of feels like you're in the interminable present, meaning like this terror that I'm feeling right now feels like it's never going to go away. And I feel like I'm totally overwhelmed by these really powerful, deep, shameful emotions. And given that it's a child, a lot of the expression of the emotions is nonverbal. So there might be more crying, more screaming, more angst, and more somatization, feeling it in your body, and not as much words to express, right? Just like when we're an emotional mind, it's harder for us to get the words to talk about our experience. So the abandoned child is very young in that way. So think of it like a really, painful, suffering, frightened child. Okay, that's deep within us. Okay, very raw. The abandoned child has very strong dependency needs, right? Because she feels very helpless and doesn't know how to take care of herself, super raw and vulnerable. So she's going to look for other caregivers to help her desperately. So it's very related to the anxious ambivalent attachment style, okay? And you can check out my recent new video on that to learn more about that. But basically, there's more of a reaching for a caregiver to rescue you, to help you get through this pain, to save you. There might be an idealization of caregivers or nurturers, right? And really wanting them to just, wrap you in their arms and make you feel okay again. You might be deeply afraid, of them abandoning you once you do get that caregiver, because you feel so raw and painful and alone with your terrorizing feelings, right? You also, what they say called, you lack object permanence. Okay, this is like a psychodynamic term, but basically what it means, like, if the caregiver isn't actually physically present with you, it feels like it's hard for you to hold on to the relationship. It's like almost like it feels like they disappeared forever, right? Even if they're just in the next room or they just went out for, or an errand or something, right? So it's hard for you to soothe yourself in the absence of that caregiver and remind yourself that, yes, they'll be back, and yes, they still love me, right? It feels like, oh my God, I'm like lost forever. They're gone forever, even if they just left temporarily, right? And that's characteristic of little children. Like, it takes kids a while to use what they call transitional objects to help them hold on to a caregiver. So a transitional object could be like a teddy bear that your parent gave you, or your blankie, or your pacifier, right? And it's something that reminds you of the parent, that helps you keep that relationship alive within you, even when the parent's not there. So the abandoned child has a poor ability to do that. So they really feel vulnerable and lost and alone. Okay, so I hope that makes sense. So as you can see, this is a really, truly vulnerable part. Okay, so how do we help our abandoned child? Okay, so if our wise adults stepped in, we try to help satisfy the child's emotional needs. We try to soothe the child in their pain and their sorrow and their fright. And kind of like the woman with that baby, she's just kind of rocking him or her, trying to make the baby feel better. So we have to do that with our inner self, trying to really soothe that child, okay? And give it all the empathy that he or she needs, all the love, all the validation, all the caring, all the holding, right? So we have to really go deep in and take care of him or her, okay? I'm sorry with the gender names. It really could go either way. And by the way, even if you're female, you might imagine some of your parts as male, or vice versa. So it's not, like it has to be one way or the other, okay? Or it could be almost like a cartoon-like figure. It doesn't even have to be like a real-like person. So however your part feels to you, is go with it, okay? All right, so here's the next part, okay? So this is a part that helps defend the vulnerable child, right? So this is the angry and impulsive child, okay? So while the vulnerable child was totally helpless in the face of not having her needs met, the angry impulsive child's like, hey, wait a minute, that's not fair. You should be taking care of me. That's not right. I have some rights here. I have some needs here, and you gotta stand up and start paying attention, right? So now it's kind of like got a bodyguard going. We got to step up our game and kind of fight for what we need, right? So this part, might start attacking the caregiver, kind of desperately saying, insulting or screaming or demanding or arguing or whatever he has to do, or she, just to get the needs met, right? It's kind of like if you're in a store and you try to take something back and you're in the customer service line and you go a little wild trying to get that item taken back. It's kind of like, yeah, I need my needs met, damn it, right? So it even might lead to emotional mind, impulsive kind of behavior, right? Kind of thrashing around and getting impulsive just to kind of get attention or get your needs met, okay? In some cases, it could even lead to suicidal threats, or it could lead to target behaviors, okay? Depends on your particular inner child, okay? All right, so how do we help our angry, impulsive child? Okay, so first thing, while we can validate the needs beneath the anger, the kid needs some limits, right? Because he's going a little overboard, right? He's getting a little bit too impulsive, getting a little nasty, getting a little bit pushing the limits. So the child needs limits, right? So we have to set limits on our own inner child's anger and behavior, okay? So DBT skills could come in here, all right? You need a little distress tolerance, a little motion regulation, a little more give skill and interpersonal effectiveness, taking care of a relationship instead of getting a little too nasty, right? But meanwhile, the adult needs to step in, and your inner adult, rather, help your child safely identify your needs, right? What is a child screening for anyway? What does he really need? Is it love? Is it just being seen? Is it the ability to just express his feelings? Is the ability to have a certain level of just being okay, right? So ask your child, well, what do you need, and how could I help you? Okay, and also teach the child coping skills for getting the needs met and getting your emotions calmed down. All right, so we're going to be kind of a little tough love, but empathic. All right. Okay, so next, the inner punitive parent. All right, so it's kind of like we might have internalized the punitive parent in our real life. We might have had somebody waving their finger at us, scolding us, invalidating us, belittling us, And now we're doing it to ourselves in our own head. So we have an inner critic or an inner punitive parent, okay? If you watch my inner critic video, it's very similar to this, okay? So the punitive parent tries to keep the vulnerable child quiet by punishing her. Like, just shut up. What are you talking about? Don't make a big fuss. Stay small, okay? Stop expressing your needs. Stop crying, right? And it's harsh. It's nasty. It's invalidating. It's judgmental. But the intent behind it is to keep the little child safe. Like, stop getting all over the place, you little vulnerable child. You're going to create trouble for yourself. So it comes out in a skewed way, but the intention behind it is to create safety. We probably could do a better job though, right? But the problem is if we keep having that punitive parent running wild in our head, it's just going to create chaos, right? It's going to lead us to more self-loathing, self-hatred, self-criticism, target behaviors because we're suffering so much from it, suicidal ideation because we're suffering so much from it, we feel not good enough, right? So that's like, not so great, right? So we have to deal with this punitive parent. All right. So we have to learn how to calm down the punitive parent, okay? So we have to be mindful of the fact that the punitive parent's running her mouth or his mouth, right? Okay, there she goes again. Oh, there he goes again, criticizing me. Okay, I'm gonna just notice that. Remember this, just trying to protect our abandoned child, and then encourage the punitive parent to use other strategies to protect us, right? So if they want to protect us, great. But maybe they could use something that's a little bit kinder, a little bit more gentle than all these harsh words, right? So maybe we could teach it how to, the adult could step in, the healthy adult could step in and teach it how to have some nicer techniques, okay? So the idea is to be safer and comforted, but we have to do it in a kinder way, all right? Okay, fourth part, also protecting the vulnerable child, right? The detached protector, right? So this part is related to the survival mechanism of like hypoarousal or the freeze response or immobilization response, right? So that's what we do when we can't run, we can't hide, we can't, fight back. We just freeze up, okay? So there's kind of a blankness there. In this mode, we're kind of disconnected from the needs and feelings of our vulnerable child self, okay? So because it's so painful, it's protecting us by saying, listen, I'll take care of you. I'll try to prevent you from feeling any of this, okay? So the freeze response makes you numb inside. It makes you like disconnected from your feelings. So it helps in a way, but the numbness doesn't feel so great either, quite honestly, right? And so we're looking kind of blank, we're feeling kind of blank, our face and our eyes are blank, we're more mechanical, we're kind of going through the motions, more of an emptiness. We might just kind of go with the flow, just comply with things, but we don't really care. Sometimes we engage in target behaviors just to feel something or to make us feel better because it just feels so bad to be numb. And sometimes we might have somatic complaints, which also helps detach us. Because if I'm focused on my stomach ache, for example, I'm less focused on my painful emotions. Okay, so it can come out in certain different ways. There's another version of the detached protector, and this is like what they'll call in the parts of self schema, like for my other video, the going on with life self, and kind of a little submissive too. So the going on with life self is like the part of you that looks functional, even though you're falling apart inside. So you're still going to work, you still go to school, you're still going through the day, doing your chores, whatever it is. On the outside, it looks almost normal, but on the inside, you still feel numb. You still don't feel yourself, right? You're probably suffering. You're not really that engaged with people. You don't feel that connected to your emotions or to other people. So like in treatment, let's say you're in therapy right now, you might show up to the sessions on time, might do your diary cards, might go with the flow, say, yes, I'll try this skill, but your heart isn't in it. You don't really feel connected to your therapist or really connected to the treatment. You're kind of just like going through the motions, okay? So therefore, you may not get a lot of benefit from your treatment because you have to really have an emotional connection to the treatment, all right? So, so it helps in a way with the detachment, but it's also some disadvantages, as you could probably tell. Okay, so how do we help our detached protector? So one thing is to get past some of the detachment and feel a little again. We need to use some mindfulness, right? So you have to practice sitting with yourself and tuning into your sensations. And in the beginning, all you might notice is feelings of numbness, right? You might not feel much at all, but you just observe it, right? Or you might observe that in my chest, I feel really numb, but I do feel some blood pulsing in my feet, right? There might be parts of your body with a little more life energy flowing through and other parts that still feel numb, but you could just notice it. And you could make space for your feelings to arise instead of just blocking them out. Okay. And when they do come, it's important to greet all of them with care, with compassion, and acceptance. Okay. And when you make a safe environment for your feelings to come out, your detached protector won't need to be there as strongly, right? It won't need to cut you off from scary feelings if you realize you can start to feel them and you'll be okay. Okay, does it make sense? All right. And also, instead of being detached in your relationships, you could slowly allow yourself to be more connected in safe relationships, right? If there's a person that is kind to you, that is kind of trustworthy, allow yourself to be a little more fully present with that person. So you can be a little bit more mindful during your interactions and, give yourself slow steps toward, sharing, toward trust, toward spending time together, all that kind of stuff. Okay. All right. So then we're just a healthy adult, right? So the healthy adult, again, is going to help with all these processes, right? So we have to go and pull her out wherever she's hiding, right? Because the healthy adult's always in there, but it might be so obscured by all the other stuff that's going on that we kind of forget it's even there, but it's still there. Okay. Just like the clouds could cover up the blue sky and you think it's just a cloudy day and the blue just vanished. But if the clouds part, the blue sky's still up there. Okay. Or like if you go on an airplane and you go past the clouds, the blue sky is still up there, right? So the healthy adult is still in there. We just got to fish her back out. Okay. So this is basically, oh, sorry for the lack of space down there, a strong, loving, and soothing parent that could help the younger parts, right? All of those other four parts. Okay. And if it soothes the other parts, it helps them become healthier too and be their best selves, right? So healthier versions of themselves, okay? And this is very related to a wise mind. Like if we talk about DBT, we talk about a wise mind. And it's also related to the concept of a self with a capital S, like a higher self, okay? So just a quick review of the higher self. And I also go over this in my parts of self video, the general one. So the parts of self ones talks about how the self is like the host, right? That provides hospitality for the other parts, right? So how can I relate to my other borderline personality disorder parts with more hospitality instead of hatred, right? So I may not like that little angry, impulsive child, but what if I greet it with hospitality and try to understand him and try to help him out and help him set limits and self-soothe, right? He starts to transform, okay? So the parts of self, I'm sorry, the higher self, all these words like scramble my mind sometimes, have 8 C's, okay? So qualities of the healthy adult or higher self relates to the other parts with curiosity, with interest, right? With compassion. So it's gentle and loving and feels the pain of the parts, okay? With calm, okay? So it's not as emotional as the other parts. It has that nice equilibrium here. With clarity, right? Because a wise mind sees things clearly. With creativity, because maybe you need some creative ways to relate to your parts in a different way or to help them. With courage, not always easy to face some of the pain that you have, so you need some courage. With confidence, right? So this, just like, if you're being a teacher, you're being a parent or a therapist, you need a little confidence to deal with other people. You need confidence to deal with your parts, right? I'm coming in with a wiser perspective here, and I can be confident about that. And connectedness, right? So unlike the detached protector that's trying to disconnect us, the higher self is trying to reconnect and reintegrate our inner parts. Okay? So that's the scoop. I hope that sounds like it rings true for you, that it makes sense. And you're like, yes, that's part of me. So practice like relating to your own parts differently. Recognize when they come out. Make that part of your mindfulness. Oh, which part is coming out right now, right? And try to slowly transform them using some of the tips that I provided. All right, so good luck. I hope it works out. And I'll see you in the next time. Okay, bye everybody.